Hello, Brian Dunleavy here for PMC Pharmacy, and today we're talking about a PBM dirty little secret. How many of you have had an issue with prior authorizations? Maybe you went to get your medication filled, the pharmacy told you, hey, you have a prior authorization, contact your doctor. Boy, this is happening more and more and more, especially during COVID. We thought that we'd see a reduction in these prior authorizations, but in fact there's a lot of evidence to suggest that these things have just increased. It's become very problematic, and I have some really cool information that I want to share with you guys today. I got this really great article from Specialty Pharmacy Continuum, and there's a report that they reference here that was put out by the American Medical Association, and it starts out like this. 9 of 10 physicians reported that prior authorizations have had a negative effect on clinical outcomes for their patients. And nearly 1 of 3, 30%, reported that PAs have led to a serious adverse event for a patient in their care. That's horrible. How is this helping any patient? It goes on. And the worst part is that these PBMs even acknowledge that this is a problem, but they haven't done anything to correct it. So it adds costs to the pharmacy, it creates a whole lot of legwork, it creates costs for the doctors, creates a whole lot of legwork for them. Nobody's paying either one of us to do these prior authorizations. And then worst of all is the patient is affected, and then you get these adverse events that are affecting their health. That's horrible, absolutely horrible. So here's another interesting little tidbit from the article, that the PBM acknowledges the problem. So even some PBMs agree that the PA process must be reformed. Now, this is a quote from one of their CEOs. Frankly, I'm on the side of the doctors here. That's surprising. The PA process doesn't work for anyone, said Jason Barcho, the founder and CEO of Abarca, a PBM based in Ventura, Florida. Our view on this is stop the madness. I agree, Jason. Some PAs are nonsensical, just administrative burdens with no clinical or financial benefit to anyone. I'd like to believe that's in the minority. But if your PA is going to be approved 95% of the time, just get rid of the PA. And there's no reason this process should take days or weeks. You should be able to get an answer in minutes. Wow, boy, that's something that we've been talking about in this industry for a very, very, very long time. I can't agree more. I don't know what this prior authorization process has to do with anybody's health or safety. It literally only serves the purpose of delaying therapy for a patient, which is really in the best interest of the PBM, because delaying that dispensing essentially delays their payment to the pharmacy, which improves their cash flow. So instead of maybe the patient getting 12 fills per year, they're getting 11.8 fills per year, and that 0.2% of a fill per patient over the millions of patients that they have turns into millions of dollars that literally just goes right into their pocket and straight to their bottom line. It's a dirty little secret, and I just wanted you to know why some of this is happening and what's going on here in the pharmacy world. Share this with some of your friends, let them know what's going on, and help us to be part of the solution in exposing some of this insanity.